right. So welcome, everybody. It's Monday, November 7th. So happy to see you all. And I want to introduce our guest for today as we start. And we are on recording, as you guys heard. So welcome. And want to introduce, so I'm not going to have any trouble, I don't think, with Laurie's name, because I grew up with Denise Patopoulos. So we have Laurie Anastopoulos with us, and you'll correct me if I should have emphasized syllable better, but hopefully that works. And Annie Nicolas, and they're from the Charles River Center. And Laurie is the Senior Director of Family and In-Home Support, and she's worked at the Judge Baker Children's Center previously, Child Abuse Emergency Line, and she served as an adoption supervisor for 16 years at the Department of Children and Families, so pretty heavy family experience. And Anne, I don't know why I'm calling you Annie. I apologize, Anne.
Okay, it's okay.
And Nicolas is also with Charles River Center. She's the program director of DESE and Agency with Choice. So, hey, that's a great topic we might end up covering today, too, specifically that we haven't covered in the other chats. So, welcome. Do you guys want to add anything and give a plug for Charles River Center or my friends there?
Thank you. Well, we just came off of an amazing weekend with Wings for Autism this past Saturday at Logan. So it was really great to be back, and a lot of really happy individuals and families, and it really ran very, very smoothly. It was nice to see so many people working together, TSA and Massport, our development department. It was just a wonderful event. So we're really kind of coming off of that from the weekend, and we're looking forward to having that again April 1st of 2023.
Oh wow.
So information will soon be going out on that. So we want people to register early for that to make sure that they have that opportunity. But yes, we're kind of opening up and really excited as we get all of our programs up and running.
So I remember that being one of the first wings, and I forgot who was doing it, and then you guys did it, and then National got interested in it and started promoting it in other states. So I just want to congratulate you guys on that and coming back. And that's awesome. And your families, I mean, you have a pretty heavy family support center, right? Pretty broad family support center. For people to get a sense of that, I asked, I like for people to know, I mean, maybe, Anne, why don't you say what your department does, and then Laurie can fill in the rest of it. It really has, I mean, you have autism services as well, you know, it's my recollection as well, but you want to share about DESE and AWC a little bit, and we'll be coming back to you on that.
I am the program director for DESE and Agency with Choice. DESE supports kids between the ages of 5 and 22. Agency with Choice provides services to adults who usually age out of DESE, or adults who are referred to us by DDS. Our DESE program is great. It assists our individuals to become more independent in their community, and they are assisted and supported by skills trainers. Agency with Choice provides the same kind of support to our adult population. So both programs are going really well, but we find that staffing is often really difficult for both Agency with Choice and DESE. Do you want to add more, Laurie?
I think we're going to be getting a lot more into that as we go on today, but yeah, it's a really vibrant program, and we work really closely with DDS to make it successful. And I think our Agency with Choice roster has grown more recently as there's been concerns with getting people back in the day program. So this is offered as another choice to families, that this might not be forever, but maybe until someone gets into day program. So we're seeing, I think, different referrals than we may have otherwise gotten in the past.
Great points, both of you. Thank you for sharing that. And so, yeah, let's get, let me just say, in the first several months, we were so pleased with DDS and how they were partnering family support centers and others. And it just felt like from that, I don't know, it took a while, it took some weeks to get going on it, but I would say from May anyway, at least in 2020 through about October 2020, maybe a little longer. It was, all hands on deck, a lot of flexibility, right? Some of the disallowables thrown out the door. flexibility, right? And then the world changed, right? And I don't know what that had to do with, right? But sort of was ramped back. So I'm wondering, like what do you do for the person, who really needs something? They have someone at home, maybe they have one-to-one, and you can't, the day service can't serve, whether it's Charles Rivers or someone else's. What do you guys try to do from the Family Support Center, or does it feel, you're on your own working with that family trying to make something work?
Yeah, I don't think that we've been very fortunate. We have 2 family support centers, one here in Needham. It's works with the Newton South Norfolk area office, and we have our other support center in Natick, which works with the Middlesex West area office. And we work really collaboratively with both offices. We're really fortunate that we have a great relationship. And I think that the issue that has been, I guess, more of the forefront is not having staffing in those programs, and we're filling in kind of holes. So we're trying to offer something. It's better than nothing. But it's not necessarily the best solution, but it's something. So for instance, in our Middlesex West area, we have an adult extended day program, and it's really viewed as a respite. So as people really came back to work, for instance, where people were really working at home, more people are having to go into their office. So our program then at least extends the day from a day program for those who are at day program to at least get a little bit more time to a parent's work day, caregiver's work day. So we're trying to look at it from like, is there some solution that we might be able to offer? The other thing is that people who aren't back in day program, we are offering our extended day programming to that group of people as well. It's only a few hours, but it's something. The socialization, the social rec, we're doing, different activities each day. So we're finding that people have found some interest in that as well. We also have had a lot of our community-based groups that stopped during COVID and started up last fall, probably about a year ago, for both adults and children, that as the months go on, we're actually starting to have wait lists because we're seeing so much more interest in just being a part of something.
Right.
So that's been the positive, but it's definitely what Ann and I talk about frequently, and Ann can probably talk more, is frustration and from families in a way thinking, okay, well, COVID's over, now I'm back to day program, or COVID's over, my child's 22 and the next step was going to be day program, but there isn't one. Now what? So I think we're seeing a lot of that, and Ann, I know you can probably add more to that.
So we find a lot of families coming over to Agency with Choice as not their first option, but just an option for them to have. And that's often frustrated because what their main goal was to get that individual into day program, like Laurie mentioned. But then the option with staying at home was not initially something that they wanted, nor do they have the staff to support them in the home. So that's also frustrating. So we find a lot of families coming on board and not really wanting to move forward with Agency with Choice, but understanding that it's the only option they have at the moment. So that's often frustrating.
So how many people just all together do you have, both groups, right? The people that wasn't their first choice and the people you have, just ballpark number of people?
For your Agency with Choice numbers?
For Agency with Choice, it's been growing quite a bit for NSN. So right now about 20.
And how many, are not, that wasn't their first choice? Probably a good couple of the new.
Yeah.
And that's, as you said to people, and one day we should do like a deep dive on this topic of DESE, whatever, because they're very similar, right? Even though different rules to some extent sometimes as well. So
they both support individuals with staffing and a stipend. So yeah.
But now, how's the staff? How do you help them get staff, or do you coach them, or does your team coach them on how to recruit? Because I sort of see like that's a doorway. It's not an easy doorway, right? But you almost are like multiplying recruiters for our field, right? When you do go with AWC or the other program, PCP. right? So do you see it that way? And even if it's hard to recruit?
So usually with the agency with choice, what I'll do is start internally. So with the skills trainers we have here, I'll send a blast and try and target them that way. Say, we have a new client on board. Here are their availability. Are you able to support them? If not, then the family and I will put together a job description. We'll post it on our platforms. And usually we get an applicant or two per month, but usually sometimes there's no applicants. So we have to start using their community and their connections. So that's what I always recommend to families. Use your connections, use the school, different activities that they participate in order to identify someone, because it's often difficult to wait for somebody to apply for the position, and it's a long wait.
Yeah, so that's a great idea, right? I have them, maybe there's a cousin, maybe there's a neighbor, maybe, and I'd love to, like, you know, put a group of people together just to the tips you guys all use to coach people, because there's got to be tips that you found work better than others. And at the end of the day, if someone's isolated, well, you know, if a family's isolated, that's going to be tough, right? No matter what, you have to then, you know, you might have some proven strategies that work with a community, but it also will take longer, right?
Right.
So one of the things, well, first place, that's excellent. I love the fact that you're doing that. You know, we have a situation. I wonder how many people know, like, that's even an option, right? That are still at home, like, especially those that were just going to day habilitation. You know, is anyone offering them, unless they ask for it, an option for this, right? And maybe they have RAP money, maybe they don't, you know, have additional RAP money. RAP money, for folks listening, that's when someone needs one-on-one at day habilitation, DDS, and no longer DDS, but additional money is made for one-on-one service. And that money, right, could be used if it was flexible. Have you had any of that experience where people were primarily at day habilitation and they don't have anything, and DDS has been flexible and allowed them to have AWC?
Yeah, there has been more flexibility with that, with each individual. So I think it really depends on the situation, what's going on. We're seeing more people going back to day program for like a day a week, 2 days a week, a half day, you know, 3 days a week. And that is nothing that anyone would have thought that they would kind of say yes to. But the choice is nothing versus, okay, we'll go 3 days per week, half day. So I think there is still flexibility, but the flexibility, it has shifted because, you know, it just has. Things are opening up and we have to kind of look at things a little bit more different, from than we did even a year ago.
Can you, how about people who need one-to-one? And you haven't probably been able to bring them back, right, into the day program. What do you find, you know, what's the situation like out there, honestly, for them, you know?
It's not impossible, but it's discouraging, I would say. And we have to reevaluate individuals. So an individual 3 years ago that could present with certain behavioral maybe concerns and challenges that would require them to have a one-to-one. We need to revisit. Things have changed. You know, people have changed in, you know, different ways. Some people have regressed. Some people have, you know, accessed the community and they're a little bit more settled. You know, you just don't know. So I think it's important that people are reevaluated in the sense that if the person you saw 3 years ago might not be the same person you're getting back. And just to be staffed properly. And I think that I know we have some assessments that we do for people to kind of really figure out what is it that you need. And I think one of the harder things is a day program, let's just say, offers, you know, 30 hours per week, give or take, right? And like an agency with choice, that's not the situation. You're not getting 30 hours of staffing by and large. With an agency with choice program. It's not a replacement for a day program. It's an option, but that is something that might not meet the needs of some families just based on they need more staffing than what could be offered.
But like you said, if they have nothing, right, and they're able to get, and maybe it translates into I don't know, I'm thinking maybe what, 2 5-hour days? I mean, what
Mhm.
do you think realistically from what you guys have been doing?
Yeah, I mean, and we'll talk more, but I think it's a
Yeah,
lot of it is,
realistically, it's usually about 3 to 4 days per week. So
Oh,
we're
wow.
we're unable to do more than that simply because we can't identify staff to do more than that. And DDS is often not willing to approve more than that. So like Lori said, it's often not a replacement for a day program.
Right. But Ann,
Right,
when you say 3 to 4 days, is that like 3 hours a day? That's more than I expected, by the way.
Yeah, about like 2 to 3 hours per day. Some
Okay.
individuals do about 5 twice a week, so it varies.
Depends on their need. Okay, no, and
Yeah.
that makes perfect sense. And then if you have someone that needs one-to-one, now the family's already has him or her at home, right?
Mhm.
So you're not really in a position where you worry about getting 2-to-1 staffing, right? Like you're not, I would think that would be almost unbelievable to think about, right?
Mhm.
Trying to get someone 2 people. But there are situations, right, where probably someone goes into the home and the family's sort of working things out, but it's probably not enough help. Has that ever happened? Where it's sort
Yes,
of, it does.
definitely.
So you might have to say, geez, we can't handle that.
Right.
You know, which makes
Exactly.
it hard. In a minute, we'll take questions in a minute. Larry, well, okay, hold on.
thanks, Leo.
And then, so that's helpful. And that's, I mean, it's complicated, but I mean, so far, so everything you've told me, everything people have been coming on of talking about this, they're sharing the same issues, the same concerns in different parts of the state, you know, and has there been any, and I want to ask this in the right way. So any sort of, I know you have great relationships, so did the other folks that came on from South Mass with DDS. But has there been any strategy or outreach to you about people who are like that and set in that situation, one-to-one, minimally getting assistance? What can we do from a strategy situation to help this population?
yeah, I think we're looking really at what the individual's needs are. A lot of times it's not necessarily only a behavioral, but maybe a medical type of a need that we have to fulfill. So we are helping people with, PCA services, nursing. There's ways to kind of fill up kind of those gaps throughout the day. But there are individuals that if it was that we can't have, we can barely find one person at times, that having two is impossible. I do think it obviously each situation is different, but we do have conversations where everyone's trying to get creative. As Ann said, we do help with these job descriptions. We're posting, we have so many colleges in the area, and every college around uses Handshake as a platform for
Oh, wow.
people who are looking for work, part-time work. And usually the schools that are responding are ones that have people who are in helping professions, if that's psychology or some mental health, PT, OT, that kind of a background, that schools that offer that are what we're hearing, or who we're hearing from.
That's great.
So it is, it's not you need to fix it. I don't feel like we're in a position that here's this problem and you're on your own ever. We really do need the help of kind of everyone at a team, where, when Ann was talking about reaching out to your community, and looking at that from a different, point of view, that they already know your individual, your child, and that's huge, a huge piece of it. The getting to know you phase is already done. So
Right,
if we can
right.
do that, also thinking, is there someone else they knew from school, from a day program, that they use somebody, maybe that person is a resource.
Sure.
So it might not be a direct connection, but they work well with your, daughter's friend. Maybe they could help us. Maybe we can do something together. There's different ways to look at things.
Great thinking. Yeah.
Yeah.
So let me ask you this question before I open it up for folks, because I know we already have one person wanting to comment or ask a question. When you're up against it and you realize you can't help somebody, or you're trying, or you're in the middle still trying to help them, what do you do? Do you recommend them to go to their DDS service coordinator? Do you recommend, look, let's try something else, especially if they're frustrated, right? Do you ask them, we'll keep helping you, but you may also want to call the area office and see what other resources there might be? Do you ever do that? Or would that be seen as, no, you guys have to, offer them the alternative? How do you handle that? Because I'm sure there's got to be some situations, right? Where even if you get them some help, it's just still feels overwhelming.
Yeah, I mean, there are situations that maybe we've been given something that doesn't seem very realistic, that we kind of go back and say, this is just not realistic. Let's talk about this on what makes the most sense, on what we can do to meet the, the health and safety is like a big piece of the
Right,
need of
right.
this individual.
And that's with when you say that's with the team, you might be talking to a DDS administrator, you might be talking to somebody.
I
Yeah.
also wanted to add, Laurie, that sometimes it's a matter of convincing that family that this is the best option for now. It's not the best option forever. We can keep talking about different options, but for now, let's visit agency with choice and see if it's a good fit for your individual and see how it goes. If it is not something that's working out, let's discuss with DDS, possibly another program or maybe respite services, but it's just a matter of getting that family on board to accepting this is what's gonna happen for now,
Available.
and this is what we have to run with.
So you never, that's interesting. So as long as they're from your catchment area, what you're telling me is you're going to try to process it through so they don't
Right.
have to go to
Just
someone else.
in order to get some services in place,
Yeah,
instead
gotcha.
of not having anything at all.
So it's a pretty big responsibility. It's like you really own it. And yeah, you can go back to the team to discuss it and what other ideas, DDS or funding, but they have to trust you, right? That
Right.
you're doing. And if they don't, they need to then get personally involved and say, well, look, why don't you see for yourself? I'm not saying you've told them to do that, but I'm just saying that would be the logical next step if they're not, in a certain situation, hearing it. Oh, that's great. Okay, well, let me let Larry, it's been dying to ask a question or say something. So let me let him do that.
Okay, I'm in a situation where my son hasn't been in he was in rehab program for 5 years, and they shut down during the COVID, and he hasn't been able to get back in yet because of their hiring issues. He's accepted into the program, but to make long story short, he's got 4 hours a day of wraparound from DDS. Because he has an issue, he developed epilepsy when he was 15. Every now and then he has a seizure. We got him on special. We have a new med now, and he might, with God's help, it might eliminate his seizures. So
the wraparound. Let me ask you this: are you using that at home? Does he live at home, or does he?
No,
he lives in a residence.
Yes.
So
the wraparound is for a day-hab program. When he goes to the bathroom. In case he has a seizure in the bathroom.
Gotcha.
He's gotten 2 gashes over his eyes. He's chipped his tooth twice. They
Right.
need a 1-to-1 person, so it's 1-to-1, 4 hours a day, for 5 days a week at the day-hab program. He goes out. I'm sorry. Go ahead.
Well, we want to ask you probably the resident. I think what Laurie or Ann would ask is what I'm about to ask you, which is the residents doing some extra activities with him, so he's not just in the residence all day.
That's just it. On Friday afternoons, they have a potluck dinner at another group residence. We have a membership for him at the Y in Andover. They've only able to get right now. When we originally got the YMCA wraparound, he loves going swimming. All the other 4 parents in the house decided they wanted a Y too. Now, can you imagine 5 kids, right? 5 young adults going to the pool. They have to bring them through the shower. They have to go to the locker room, bring them through the showers, go to the pool, bring them to the showers, back to the locker room. Not practical.
Right. No, your point is it'd be great if he could get some individualized. I'm going to cut to the chase on your point, which is it'd be great for your son. What's his first name?
Keith.
It'd be great for Keith to get some more sort of customized a couple of times a week, right? So someone to take him to the Y on his own. And Laurie and Ann, have you seen any situations where they've authorized that additional dollars for residents? I think that's where Larry's going with this.
Yeah, so since we're more in family support, we haven't, but I don't know, again, I think it's about the creativity and bringing up like a solution. So when we're going and speaking with DDS, we're trying to be very solution focused. Now, this is what my thought is. Obviously, bringing 5 individuals to the Y can be really difficult. Not that it sounds great for everyone, but everyone needs some assistance. It's not practical. How can we have this wraparound, we would like to get creative with this, that he's able to go during the day, maybe when other people are at day program, something like that.
Right.
My son's mother pays $18 a month for the Y's whatever the
Yeah,
membership, for the
Membership.
Y membership. Originally, the house manager said they'd take them 1 to 2 days to the Y swimming.
sure.
Okay.
No, Larry, I don't
Yeah.
mean to cut you off, but I think we got your point. Let me share what they're saying is what would be great is first make sure if they got more funding that the house would then figure out a way to get a staff in to take your son a couple of days a week on his own to the YMCA. Or two staff or two guys to take two guys swimming, right? Because that's probably still practical.
Right.
And it's really essential. It's been 32 months. He really needs this, you know? Can we please figure this out and get some additional funding to the agency that's serving my son so we can pull this off, okay? And yeah,
Let me continue. He was at WCI. He was doing Meals on Wheels twice a week. He
no,
was
I hear you.
doing- Okay, okay.
No, and I don't mean to cut you, it's only because others might want to bring, if others don't bring something up, I'll let you talk again. But the bottom line is what you're experiencing. So many people share that with you. And we want to encourage you toward a solution like Laurie was saying. Go ahead and work toward that solution for Keith. He deserves it. And just do it in a way, you just have to treat them like a partner. And if you get turned down at first, please, I don't think you're hearing me, you know, to go to the next level. And maybe there's another parent who wants the same thing. And maybe there's two of you, you know, that are working toward the same thing. And that might be a little more powerful. Okay.
Yep. Thank you, Leo.
You're welcome. You're welcome. And thank you for the
Thank you, Laurie.
You're welcome.
Oh, take care. Have a good day. Somebody's waving me and telling me, good luck. Sorry for those of you that listen to the recording. I just wasted 2 minutes of the recording in addition to everybody's time here. So just anything else people want to add as we're talking about these issues? We've covered really a wide range. I'm gonna ask a few more things, but is there anybody else who wants to ask a question or make a comment, as Larry did about their situation? Maybe you can get some free advice here from Laurie and Ann. You just got some good advice. Go ahead, Janet.
Hi, Ann.
Hi, Janet, how are you?
Hi. Good news is Jim is gonna try to start Maddie Wednesday for 2 hours.
Mhm.
Matt is freaking out, doesn't
Okay.
want to do it. So do you have a police escort we could have?
We don't.
It's
But
that bad.
I'm pretty good at convincing people to come on board and do things, so I'll be right there with him
On that Wednesday?
on
this
that Wednesday. Yes.
Sounds
Yeah,
like a
you
good
might
boy.
be helping me more.
So Janet her son is coming on board to Agency with Choice, hopefully, and our maintenance department agreed to bring him on board as an employee. So he's coming
Oh,
for
wow.
an interview on Wednesday.
Oh, wow.
We're very excited.
Yeah.
Yes. And they're such a wonderful group
Yeah,
that I know it's gonna be hard.
Yeah.
Jim talked to him and
Mhm.
he hung up on him.
Yeah, he told me.
Oh, that's pretty cool. So not only is he like Agency with Choice, but he's also going to get a job out
Yeah.
of it. I
Yeah.
love it. That's pretty damn, you were talking about creative and you didn't give me that as an example?
Oh, I
Man.
forgot.
Well,
Thank
because
you.
it hasn't happened. It's
Well, that's
really,
good. Okay.
It's in the works.
Well, I can
it's a
see,
dream.
Janet, you're solid parent. I can tell, I'll believe it when I see it kind of thing. I get it, but it's pretty exciting, pretty exciting. And, glad that glad you're on to,
Thank you, Ann.
No problem.
great. All right, Ann. Anybody else want to add a issue they're having like Larry did or a concern and or almost solution that looks like around the corner, which is pretty cool. All right, let me ask you about the tension question. We were talking about that earlier, and that's Janet wasn't so tense as she is anxious about what's about to happen. But when you do, we heard Larry ask his question, but his personality seemed pretty cool. He wasn't, he's frustrated about the situation, but he presented it very well, presented it emotionally very balanced. How's it going though, when you experience that tension? Is it a lot worse than it was 3 years ago from your perspective? And how do you try to de-escalate? And what could you tell people? How could they help each other in terms of, besides asking for help, right? Sometimes I think people don't ask for help, right? Because they've been doing so much for so much of their life as caregivers, and they sometimes feel guilty saying, let me go to the next step, right? And be more assertive.
Right, and I think we're seeing a lot of the frustration is really the transition age. For the turning 22, and we're actually at Charles, we are gonna be, I've gotten on board with the DESI
Oh, good.
the grant, so it's going
Yeah,
to be the
yeah.
transition grant, and it's really what we're hearing from families, and I repeat it often, is feeling that they've been thrown off a cliff.
Yeah.
That, and I say going through the regular primary years of school, you're going to go to second grade, you're going to third, maybe seventh, eighth, ninth. Then what happened is COVID, and some of the stuff that schools would do, I don't know that any parent would say that they were so thrilled even before COVID with everything from school.
Right.
But I think that everything just kind of crumbled, and some of the stuff that people got, I think they missed, and people are wanting all of this, and hopefully with this DESI grant that will also help individuals. But the frustration is just they don't have information that they normally would have gotten. So I think it's the lack of communication that was not, I don't think, intentional, but
Right.
it was a product of what was going on in the world. So all of the individuals that we're hearing from, for the most part, is just feeling not supported. And when we'll use the word programming, for instance, in
Right.
family support,
Yeah.
people will assume we're getting their child into a day program.
Yeah, probably not the word you should use. No,
Right,
go
so
ahead.
we're looking at community-based, right? We have community-based social recreational programming, so we're adding as much to it. Because someone who has not joined the adult service world is very shocked at really you're more on your own than ever before.
You know what, it's always been a problem, and Carrie and Kathleen are on, but what strikes me about what Laurie's saying is what I didn't think about. These are the kind of specifics I love getting out of these sessions, because it sort of magnifies the communication issues that you might have had normally in transition, because we're now tripling, right, the classes. And in case of year one, right, people graduating at the end of fiscal 2020, 2021, they might be totally out of a loop unless they're very proactive, right? So that's something to get back to DDS. Look, folks, you have one person handling turning 22, but in fact, here's another specific area to concentrate on, and working with family support centers. But if you work, I mean, the other things, you guys can only do so much, like you got to get more support financially to add to your, assuming you can find someone to add to your roster, because if you're, going extra for, what you're doing now with AWC, right, and building that group, at the same time, there's a dearth of information that's out there for maybe almost 3 graduating classes. I'm not even sure what they're telling this graduating class, right now even, but I would argue through fiscal 22, there's been a gap, right?
Yep.
So I don't know if that never struck me as it did just now. You're explaining it's potentially far worse than historically has been. It's always been tough.
Right. I mean, you just think about travel training in general. People weren't going to go on the train on purpose to go with when the virus was really brewing. It's not something you would even think to do. The basics, going into stores, cooking, basic house kind of keeping, budgeting that you would do when you go to a store. You weren't really going into stores unless you really had to go into a store. And then there's also even going to a movie, something that's more of a social type of a situation, people avoided. And so we're really seeing that impact on people. And especially with those who had a one-to-one in school, it's even more difficult, I think, this transition period.
Right. Wow. And so thank you for bringing that up. Yeah, I think we covered, I mean, short of, we don't want to get into too much on the tension, except to say it's there and it's powerful, and it's something you're always working on, I'm sure. And so I'm wondering if it would make sense. So we had Government Affairs Committee today, and one of the things we talked about, and we actually brought this up at last week's webinar too, was what are you doing? What are strategies you're having when people aren't utilizing their funding? So, for example, by the way, what I brought up was people were asked to use their family support flex funds for transportation and day and work programs. And I thought, why is that happening? Is that happening at your place too?
Yeah.
Yeah.
Okay, so just for the record, so you know this, and we're gonna be talking to DDS about this, is there's actually all the contracts with day programs were set at the governor's budget. But the legislature allocated 50 more million in day services alone. So so the fact that people are using their flex funds for that. Now, I know that certain DDS offices are worried that they'll give money and the money will be reverted. So that's part of the right, what they're doing. I get that. But I think right away, when someone uses it for a day or employment driving, they should be, added on, right, to their flex fund. So we'll work on that. But you're now the fourth or fifth folks that have confirmed this, which now makes it past anecdote to way operating standards. So what I asked these folks were, if we were able to see DDS and lead sort of with family support centers and possibly AFC programs, concerted strategy for those that are stuck at home that still aren't taking advantage of additional services, right? Because there are people, I bet you, that are unbelievably struggling that you don't maybe even know in your catchment area. Would that be something, does that make sense? And one of the people talked about what they're doing for the adults with autism who have, actually your neighbor, he mentioned, people who struggle, right, because of mental health, or I'm adding executive functioning issues, and they never get around to hiring that coach. They never get around to, and I said, well, what are you, I said, he said right away, we're now adding some time for people to at least meet with people twice a week to facilitate that. So, well, that's a great idea for the people that are stuck, who have one-to-one needs, right, for their son or daughter, to have people personally meet with them and help them develop a plan like you're doing, how to use your local network, right? How to use whatever to get some staffing, as opposed to waiting for Godot or waiting for the day program to open one day, right, for them. Does that make sense to you, a strategy like that? Sort of like a, I want to call it a case management strategy, but a more in-depth kind of approach that's not, it's an active case management strategy to get to a solution, a service solution.
Yeah, yeah, that's what I think we're doing more than probably we would have been doing before. Is
Okay.
really having to do more. It is a little bit more case management, not just the navigation of, let me just help you navigate this, call this for housing. It's definitely more like kind of hand-holding partnership, I would say.
I like it. Yes. So that's literally for the people you work with, and that's what I could hear in the AWC example. But you only have so much capacity, right?
Yes.
To be able to do that, and so it would help to know who else is out there and how do you identify? I mean, I don't know if this has happened with a day program. In your case, identified all the people that aren't being served and told you about it, but some of them may not even be in your catchment area, right?
Right.
Family support. And did then maybe those be referred to the right catchment area for help? I don't know. Do you think they were?
I don't know.
It hasn't been happening elsewhere. I can tell you that. It hasn't been. Okay.
Yeah.
So that's a good example. That's another specific thing you're getting me to think about that is doable, right? Like the day programs know who's not coming back, right? Who hasn't come back. So, anything else you'd like to add, Laurie or Ann? I mean, this has been really educational and also for me.
Yeah, I think when you were saying, Ann and I were talking earlier, and I was saying just like how we really, what's a big solution to this? It's a workforce crisis, but I think having just placing value on the work that is being done, the really, really good work that's being done, and the individuals that are providing that work really needs to happen. And it's really it is a value piece of this that it is. So we need more staffing, but we have to really value them and the good work they're doing. I just know when I see our day staff, obviously we can also use more staffing, but it always like warms my heart when I'm seeing people with our individuals, just their family. This is not, I know they're getting paid. This is family. This is their brother, essentially.
Right.
And that's very special to be a part of, just to see the respect for the individuals, the dignity, just being able to kind of have everyone live their best life as best as they can. And it's amazing to watch, and more people knowing what good work is out there to be done, I think is an important piece here.
Awesome. I love it. glad you guys had that discussion. Well said. I want to add something for the people on today because I didn't bring it. It was in notes from the ARC this week, and that's you know, just fitting with the respect that people deserve. Is the good news last week, November 2nd or 3rd, I'm trying to remember when it was, that the House and Senate voted in their conference committee package to put together a combination economic development bill and close out for the last fiscal year budget. That included $225 million for the Chapter 2257 folks. And that's more, that's 225 on top of the 230 million the governor had done. That gets us somewhere around $19 or so. We're hoping for even more, but what'll happen is the first 100 million will go only for staff increase, which is fine, right? And then the second 125 million, 80% of it has to go. And that includes frontline directors. It includes nurses, clinicians, which obviously we want in addition to DSPs. And the second one is tied to evaluating what it'll take to get a higher percentage percentile for the Bureau of Labor Statistics in Massachusetts. So that whole thing that we've all been advocating for. So, and that's part of the respect, right? Is paying people at a place where they can have a life with this. And for us, our profile had been 2.5 years ago to be at 17 when it was at 15, and to go up to 24 as a plan for DSPs, $1 an hour, just, you know, but you know, we're gun ho and we're hoping to get to $20 and change. And we're glad to be working with other groups to do that. So, you know, Laurie, Ann, thank you. I really appreciate today. This was really, you're well-spoken, and I feel like it's been 2 weeks in a row of some great family support stuff. Just so you know, we're doing 6 weeks of this, and nursing is going to be next week. And the problem with the nursing, having enough nurses. And I think we're going to do PCA the week after that, though I haven't identified anybody yet. But previously we had Hillary Dunn. I can't believe I'm spacing out her last name, married name, but she's talked about the crisis from the Disability Law Center. And the week after that was Ellen Taliades, who's my colleague at the Association for DD Providers. So this is your part of that thing that we hope legislators will catch pieces of, and not just families and staff in the field. So we'll be promoting it big time. So thank you for being with us. I look forward to down the road. We'll get you back again. All right.
Thank
Thank you so
you.
much.
Great
Thank you
seeing
all.
you. Thank you so
Bye.
much.
Take good care.
God bless everybody. Take care.
Bye-bye.